Okay, hello everyone. Today we are interviewing Dr. Sarabjit Virk. He is an optometrist, and we will ask him various questions about vision, about eyesight, and other concerns regarding this pandemic. All right, thank you for joining us, Dr. Virk. How are you doing today?
Fine, thank you. Thank you so much for having me today. And thank you so much for Dr. Chopra also. She's arranging all of this. She's putting so many efforts to help the community and help keep everybody healthy.
All right, so I would like to start off first with could you give us a background about yourself? How long have you been practicing? And how has your journey been?
I graduated as optometric physician in 1992, and I started practicing in the same year. And I'm practicing since then in this eastern east side of Greater Seattle.
Mm-hmm.
And uh, from 1999, I started more specialty services to give full service to our patients. And as the need arises and the new technology develops, we add more and more specialty subspecialties to our practice.
All right, thank you. And then I would like to ask, since with COVID right now, what I've noticed is that children are always inside. They're using their laptops, even everyone is working from home. And what would you say some concerns would be with that relating to vision, eye loss, eye problems? What would you like to give us some insight regarding that?
Yeah, that's a very good question and burning question because as we know, even before COVID, kids were using a lot of computer, and particularly now they're using a lot of computer indoors.
Mm-hmm.
And because of winters also, they don't go outdoors very much at all, and that's causing very serious problem. It's a worldwide problem, but more so in Asian countries where kids are very studious and they spend a lot of time studying inside. um,
Mm-hmm.
we know that we cannot avoid computer use, but to use computer properly will help a lot. And
Mm-hmm.
we can actually give a demo how to use computer screen that will save a lot of time. And I think I'll request Dr. B to show how far the computer screen should be
Mm-hmm.
and at what height we should be sitting and what should be the angle of the computer screen. Dr. B, can you come here please and show the audience?
Thank you.
No
Okay.
problem. I think we need to move it a little bit. So if this is a computer screen. My eye level is at the upper, can you tilt it a little bit that way? So upper of the screen itself.
Mm-hmm.
And the top of the screen is tilted backwards. I don't know if you can see that angle there. And then, so.
Can you see?
Yes, I can see it. I can see it.
And that would be proper position.
All right, so that's the distance that computers should be placed down. They should be tilted backwards.
Yep,
Hmm.
about 16.
We'll talk about that, yeah,
Yeah,
in more detail. Yeah.
yeah.
Okay. So basically, the computer screen should be as far as you can and still
Mm-hmm.
see computer print. Minimum should be knuckle to elbow, but that's too close. But it should be farther than that. And the computer screen should be slanted, not vertical like this. It should be slanted. So it's
Mm-hmm.
and it should be lower than your eye level because it's a reading posture. It should not be at your eye level. What it does is keep your eyes not too much open. If eyes are too much open, then they're more dry. And also,
Mm-hmm.
it's not good for our neck.
Yes, that's true.
Yeah. Another thing to keep in mind is when you're working on the computer, you should be looking far away. Every few minutes, just look far away. Just
Mm-hmm.
a second or two. That's it. But that keeps our focusing system in flexible state, which is very important for young patients to use their focusing system properly because they have very strong focusing system. They can
Yes.
easily overuse it or misuse it, and they can
So
cause.
those would be the exercises you would say that you would suggest children and people that use computer more to perform. Just look around every couple of minutes.
Yeah, and this and computer keeping distance of the computer a little bit farther will help them a lot.
Mm-hmm.
Also, they should blink more because when upper lid touches the lower lid, it activates the glands which protect our tear film.
Mm-hmm.
Because of lack of blinking, any task which needs our concentration reduces our blink rate. Because of
Yes.
lack of blinking, the dry condition is happening in more, and even in younger and younger patients. So that's very important to do that.
All right. What would you say? Would you say like the more we use computer, that's affecting our eyesight more? Would you say that, or is it because of the strain that we have on the computer at times?
Yeah, actually, both actually computer print is harder on our eyes than the print material.
Mm-hmm.
Computer print pixels, they're like dots, and that's harder on our focusing system. If we get if we have a preference, if we can uh, do use the like print material, that's better. And that also for the young patients, they should read in good light. I
Mm-hmm.
know they can read in dark also, but it doesn't mean that they should do that.
Yes.
Also,
So,
computer
mhm.
uses like a close-up distance, which is like put some strain on our eyes anyway. And if they can use computer glasses, they'll be very helpful. They will also protect them from blue rays, which are also they upset our sleep pattern and other side effects also. So it's better to protect our eyes from blue rays as well as from eye strain.
Oh, yes, that's true. I've heard about like Blu-ray glasses to use those when you're using the computer
Yeah.
mostly at times.
Yes.
All right. And then would you say like for vision control and eyesight, there's a specific amount of time a child should spend outside or like even adults, how much time we should spend outside versus screen time or indoors? Anything like that?
Yeah, definitely. This uh, prescription in children getting worse and worse every year is because of that, because of lack of outdoor activities.
Mm-hmm.
Sunlight has definitely a role in that, in control of nearsightedness getting worse and worse every year. So they should spend in general like 1 to 2 hours outdoor, very, very important. And they can do some physical activities. And if parents can do with the kids, that's even better. But definitely outdoor activities are very, very helpful. And that's the reason why myopia is a nearsightedness, is a worldwide problem because of lack of outdoor activities these days.
Oh yeah, I've also noticed that like in more children, more people generally like tend to have, glasses, they tend to have higher prescriptions, and we can see that as you're explaining that it's because they are mostly indoors lately now, and
Mm.
there's less physical activity, there's less opportunity to go outside. Would you say that?
Yeah, definitely. Like I said, outdoor activities is very important, and to use the computer screen or any reading material properly, the way we explained, or if somebody has more questions, we can send them more material on that. We have
Mm-hmm.
print material on that also. We have our own material made for these things because we give to our patients also because it's very, very important. And so, in general, we can, on the community level, we can actually on community basis we can help our kids to keep their prescription stable, and
Mm-hmm.
first of all to keep them out of glasses by using their focusing system or the vision properly. They can be out of glasses, they can stay out of glasses. But if some kids have glasses, we definitely should keep a close watch on that, make sure their prescription doesn't get worse every year,
Mm-hmm.
because higher the prescription, higher the risk for some very serious eye diseases like
Mm-hmm.
detachment, glaucoma, macular degeneration, and cataracts, which happen at later stage of life when the damage has already been done and nothing can be done at that time. And what
Mm-hmm.
happens here is because our eyeball elongates, and that's why the prescription gets worse every year. That's every year with the nearsightedness.
Mm-hmm.
And once the eyeball has assumed as a shape, it's a physical shape, right? Physical change, and we cannot squeeze it back. We cannot reverse it. So something fortunately can be done now to so the eyeball doesn't grow. And there are different ways to do that. First is uh, bifocal glasses, which
Mm-hmm.
are effective, but not to great extent at all. And the other is bifocal soft contacts or bifocal hard contacts, which are quite effective.
Mm-hmm.
And other one is atropine therapy. There's special drops which child puts them, uses them at nighttime, and they can keep also the prescription from getting worse every year. And the fourth and the final one, which is most effective, is called orthokeratology.
Mm-hmm.
In that, child wears the specially designed lenses at night time. And those lenses, they, like I said, they're most effective in controlling myopia progression. And not only that, they also correct the vision while child is sleeping. So when they wake up, they remove those lenses and they can see clear all day without any glasses or contact lenses.
Oh, all right. That's interesting. I haven't really heard about this before. This is the
Yeah,
first time.
yeah. Unfortunately, even in this uh, advanced country, most people don't know about orthokeratology. Whenever we tell parents that this is what child needs and this will be most beneficial for them, they said, "Oh, I have never heard of it." There's very, very common response from the parents.
Mm-hmm.
We are all kind of guilty for that because we should be educating more on, like, in schools, in wherever the parents get together, or at um, different opportunities we have, like to talk in like churches and temples and any common places. And the other thing is, like, doctors who don't even specialize in these, in it's called myopia control
Mm-hmm.
area, they should educate their parents that what is the best option for the patient. I had one patient, um, uh, who had prescriptions that were so high, like -10 diopters, is very, very high prescription. And
Mm-hmm.
um, when they went to the doctor, their optician told them, "Why don't you do something about it?" They said, what is that something? Said, means you can control your child's prescription is getting worse every year. And they said, what to do about it? She said, go to somebody who does it. Said, what,
Mm-hmm.
who is that and what they do? And then
Yes.
we go to same, actually, temple, Gurdwara Sahib.
Mm-hmm.
Then they talked to people and then they told about us and they came to our practice. So fortunately, that prescription has been totally corrected. -10 diopters is very, very hard to correct. But that child, when they wrote their success story, they said, I was going blind. I thought I will never be able to see clear at all. And
Mm-hmm.
thanks to keratology, that I can see now without any glasses at all. So there are multiple benefits of orthokeratology. When a child can see without any correction, without any glasses or contacts, they feel free.
Mm-hmm.
Perception changes. They can swim, they can do sports, they can do any activities which need correction. For example, if they're playing basketball, if they're wearing glasses, they can fall down and they can break, and
Mm-hmm.
things can happen. If somebody is wearing contacts during the daytime, if sand particle goes underneath the contact lens, they can scratch their cornea, which can be very, very
Mm-hmm.
painful also, and they cannot even complete their sports event that day. So it's really very, very beneficial. We cannot talk enough about it, what
Mm-hmm.
for orthogatology are, and we should all talk at on community level, that because it's a, like, financial, we can be saving our society from financial burden also. Because if there's any retinal detachment or macular degeneration, to treat those diseases is much more expensive than preventing them. And also, the quality of vision is not same. So we'll be helping everybody, society as well as the child, as well as the parents. And
Is there a specific like intensity of prescription that you can't do orthocatology with, or is there a limit to the prescription? How is that?
yeah, very, very good question. Really very good question. FDA approval is up to -6 diopters.
Mm-hmm.
And also, FDA approval is only for nearsightedness, like myopia. In
Mhm.
myopia, control is not FDA approved yet. This term, but doctors know that um, the the ways, the treatments which help control the myopia progression is very beneficial for the child.
Mhm.
FDA approval also is a this follows the already the treatments doctors are doing off label, right? Now my
Mhm.
friend, after which I'm telling you, there was off label because it's not FDA approved yet.
Yes.
But we know enough from our experience that we can do that. And
Mhm.
I think this for since 1999, for quite a long time. And so we have enough experience to know which lenses to use, which lab to use, which lab can design these kind of lenses so that they can help the children. Because if we wait for FDA approval for that 10 minus 10 diopter child, that is not good for that child, right?
Mhm.
So I think when it's like also she is wearing them safely. We are monitoring her very closely, and she doesn't have any side effects from that. No, like swelling in the eyes, no
Mhm.
ulcers or nothing like that. We what we do is we recommend very proper eye drops and solutions which are recommended by International Academy of Orthokeratology, so that they don't use any substandard eye drops or solutions to cause any which can cause any side effects.
As we were talking about eye drops, I like remember like whenever I go to the eye doctor usually, like I've noticed that I tend to have dry eyes. And I asked like the doctor, like, like what can I do for my dry eyes? Like how can I fix them? And he usually like I usually get like, eye drops prescription or get recommended to use these eye drops. But is there anything different we can do for dry eyes or any suggestions you might have regarding that? Because I know dry eyes is a large problem with everyone.
That's great. That's again a very good question also, because dry eyes is another very, very common problem because of the computer use.
Mm-hmm.
And also there are other factors like air conditioning or central heating, all those environmental factors, and some medications can cause, some systemic diseases can cause dry eyes, and age itself can cause dry eyes. There are so many factors can lead to dry eyes. And other interesting thing is that 70 research shows that 74% of the patients who have dry eyes, they don't
Mm-hmm.
complain, they don't have symptoms, they think this is a normal process to have some
Yes.
discomfort in the. But
Mhm.
dry eyes can affect the quality of vision also. Vision can be blurry also. Vision can be fluctuating also. My vision gets was during the in the afternoon when my eyes get tired. I don't feel like working anymore. I feel like closing my eyes. All of those things, they actually reduce our efficiency and our quality of work time also. So dry eyes is also a very important aspect to talk about. And like you said, uh, I think recommending patient over-the-counter eye drops is kind of avoiding the problem,
Mhm.
because research shows again that over-the-counter drops, they don't help the dry eyes, only just momentarily, but in the long term they make the eyes worse because they reduce our tear production.
Mhm.
People used to use a lot of Visine, but I think they're getting that's getting less and less used because people are more patients are more educated about all the doctors that Visine is the worst in eye drops, over the counter eye drops. There are some drops which are medicated drops like Restasis, which increases tear production, but that's very expensive,
Mhm.
like $400 or $500 per month.
Oh
And
wow.
other drops, the Zydra drops are also good for dry eyes. They also prescription drops, and again, very expensive. Even if the insurance covers, but that's again is a burden on the society. There's
Mhm.
some natural and homeopathic drops called natural ophthalmic drops, which actually enhance the tear production. They're preservative free, and they they don't give you any side effects. They are also ready to show in the increase in tear production. These are the eye drops. If you can see, can you see those?
Yes, I can see them right there. Called
Yeah,
natural.
yeah.
Yes,
That's
natural ophthalmics, woman's tear stimulation homeopathic eye drops. That
yeah.
is something our viewers can see, and that's something they can learn about more too.
Yeah. And also, our clinic is a preventive care. We believe in preventive care. So
Mm-hmm.
all these natural homeopathic drops are in that direction. And even for cataracts, there's drops available for cataracts also. They have a compound called cineraria, and they also at least delay the onset of cataracts. And again, they help to lubricate our eyes also. At least they don't give any side effects. They are not like clinical trials to prove that that's true, but actually they do help all our patients who use these drops. They
Mm-hmm.
like them. You can see them.
Yes. Yes, the natural ophthalmics cataract eye drops.
Yes. And there's some for allergies also.
Mm-hmm. All right.
And these kind of drops we use for orthokeratology patients also.
Oh, okay. And these are all to like prevent, like prevent cataracts, prevent,
Yeah. Yeah.
dryness or allergies.
Yeah, right. What we do is we start with the to enable our body to take care of the dry problem naturally.
Mm-hmm.
And when we say that, what we do is we recommend them hot compresses because this condition called MGD, meibomian gland dysfunction,
Mm-hmm.
because of lack of blinking, that is the most common cause for the dry eyes. I mean, about 90% of the times, that's the reason
Mm-hmm.
for dry eyes. So hot compresses do help with the dry eyes because they help open up our glands so they can start functioning again. But that's not good enough because that treatment does not raise the temperature of the lids up
Mm-hmm.
to like 42 degrees Celsius. There's another machine, another device called temperature. It's a infrared frequency use, and they raises the temperature of the eyelids only um, between 40 to 42 degrees Celsius when the clogged like glands like fat melts into
Mm-hmm.
and it massages it and cleans the lids. That is the most effective treatment for the MGD condition, and the patient feels a lot better. We have some patients who got that treatment. We can actually show you video on that also.
Oh, yes. That
Yeah,
would be great.
yeah, and they feel a lot better. And also, what it does is it helps rebuild our collagen because we lose collagen with age of 1% per year, and it helps to rebuild the collagen also under our skin. So tightens our skin and helps reduce the wrinkles also. And
Mm-hmm.
can you see the video? Can we
Oh,
get the
right here. Yes.
the audio also, the voice also, volume? Can you see? Dr. B is treating this patient.
Mm-hmm.
Can you hear it? Can you see it?
Yes, I can hear it.
That's called temperature. It's very, now she's doing the whole face, I think, right? But um, this is actually for what she's doing is for wrinkle reduction also to build up her collagen. It
Mm-hmm.
like kind of rejuvenates the skin and makes the skin like more young and fresh. And there's nothing wrong with that actually because um, wrinkles don't look very good.
Mm-hmm.
In particular, the eyes, that's a separate treatment for the eyes only. So that's a different kind of handheld device used for that
Yes.
different. So we do the eyes only. And
Oh, all right. This can be used on the eyes too, to help with the
exactly, yeah,
MGT.
yeah. So you got this right.
Mm-hmm.
And if the anybody needs more information of any of our treatments, we'll be more than happy to provide them, and we
Mm-hmm.
can provide them about the dry eye treatment which we give to the patients. If we have, we can show you there also, please.
Yes, that would be great.
Yeah.
I'm pretty sure we have a lot of viewers that would like to know about that more.
Yeah. And we also give them like supplements which help soften those glands which are located at the lid margins so that when they do the heat treatment, We have our own way to show the patient how to express them like this. Put your fingers along the lid margins and move
Mm-hmm.
them back and forth. That helps to express the glands. After they have done the heat treatment, they
Mm-hmm.
do the heat with at home also. We have a special hot package also. Can-
Can I can't screen share the document. Can you?
Okay, yes, I'll enable that right now.
Thank you.
1 minute.
Yeah, this is the hot pack. Patient will microwave this for like 25 seconds, and they lay down and put this on their eyes. It's very relaxing also. And they keep there for 8 to 10 minutes, and then at the end they do this part which I showed you like this.
Mm-hmm.
Press them for 1 to 2 minutes and put lid like this. It's very effective.
Are you able to share the screen now?
Yes.
Okay, there.
Something here.
Okay, so for your screen, I can just see the name. Like Bungee Virk name is coming up, but I don't see any document. Oh, there, right now. Now we can see it.
Yeah, that's for the dry eyes. You can do.
Mm-hmm.
And there's a two different ways to do hot compresses. Like
Mm-hmm.
that, to start with, how we recommend the patient. This left page, she shows them the what supplements they should use, what they should do,
Mm-hmm.
humidifier and the hot compresses and decrease caffeine use and all of that. So
Mm-hmm.
that's what we give them, and they come back between like 3 to 4 weeks. Then we see what else needs to be done, and if
Mm-hmm.
if any inflammation, we give them anti-inflammatory drops also. And then finally, patients who don't get full benefit from these treatments, all these treatments,
Mm-hmm.
all these treatments are exhausted, then we put them amniotic membrane. Can we bring that? The no, can we bring them
Yeah.
from the freezer? We have a membrane called amniotic membrane.
Mm-hmm.
This is derived from placenta of healthy moms, and that tissue has very strong healing power.
Mm-hmm.
What happens is with the dry eyes, with the chronic dry eyes, the corneal nerves get degenerated. Those
Mm-hmm.
are important for keeping our cornea healthy. And when we put this membrane on the cornea, we put a contact lens over that. That's one way to do it. There's another kind of a membrane which is even very effective. It's a frozen. We keep it as frozen, called Procera. And that it's kind of like a large contact lens we put on the patient's eye, and we either tape or we don't tape. And then within 5 to 7 days, this gets absorbed on the patient's cornea,
Mm-hmm.
and the patient heals much better. So patient's cornea is healed, and then the patient's glands are open. So patient's dry eye should be totally and much better. We say don't say cured, but it'll be much better. Okay.
Yes.
Only
That
problem.
would be like great for the patient too, it would
Yeah.
be a problem they're able to solve.
Yeah, those are most advanced. Those two most advanced treatments and most effective. And also
Mm-hmm.
the amniotic membrane. If some
Yes, these
ulcer,
ones right here.
yeah. If somebody has a corneal ulcer, we used to use like fortified eye drops and all that. It was hard to do, but these days with this membrane, it's
Mm-hmm.
okay. They treat it very well, and corneal ulcer is the most effectively treated.
I have another question that I like, I have some relatives or some people that I know, and their prescription ends up being very high. It's too high to the point where like they're not able to wear contact lenses because their prescription is not according to contact, so they have to wear glasses, which may end up being very thick. Is there any like treatment for that? What do you know more about those conditions?
Actually, yeah, there could be actually, there's another one disease called keratoconus.
Mm-hmm.
Where the cornea keeps kind of bulging and cornea keeps like thins out. It's
Mm-hmm.
term called ectasia. That can happen with the LASIK surgery also. And sometimes there could be side effects from the LASIK surgery also, that the patient cornea is not same healthy as before,
Mm-hmm.
and like termed as compromised cornea. Somebody has cornea like thinning, like I said, uh,
Yes.
ectasia because of keratoconus disease also. And there's some other conditions also, like refractive conditions, like patient's prescription, maybe astigmatism is so high that either glasses or contacts cannot correct the vision
Mm-hmm.
um, to normal. And for those patients, there are special contacts. They're called scleral lenses. They're very large and hard contacts. I can show you the lens also, Dr. They're like, they're surprisingly comfortable contracts.
Mm-hmm.
Well, now they're very large. It seems like they'll be very
Yes.
uncomfortable because hard contracts are harder to get used to compared to soft contracts.
Mm-hmm.
But smaller contracts are harder to get used to and harder to wear. But these are large because they cover the more than the cornea also. They cover a little bit of the white part also. So
Mm-hmm.
they go underneath the our lids. So they are very comfortable to wear. I'm going to show you the lens is kind of transparent. I don't know how well you will be able to see. It's like this. But don't we? Can we get the ortho lens also, please? Normally lens. Can you see this lens or between my fingers?
Yes, I can see them right there.
Yeah, right there. I'll show you the other lens also, which is much smaller, which is hard lens and used for orthokeratology. And if you can see this on the background that we brought, nice background. Can you see it
Mm-hmm.
better?
Yes.
The ortho lens is smaller.
Mm-hmm.
Let me show you that also. Compared to that, it's like this is about 15 mm or 16 mm.
Mm-hmm.
They different come in different sizes. And this lens is only about 10 mm.
Oh, okay. So there's a difference in their sizes.
11, this one. Can you see?
Yes, I can see them.
Great. And this is also good for dry eyes because it is filled with a solution with
Mm-hmm.
preservative-free saline solution, and so the patients are bathing in a um, very nice solution all day, so they don't feel dry. It's a good treatment for the dry eyes also, and also not only that, some people they need special eye drops
Mm-hmm.
from their made from their blood who have very serious eye diseases of dry very severe dry eyes.
Mm-hmm.
Put that solution also in these lenses and they are helpful all day. So they what these scleral lenses do is they created their own optics, new optics.
Mm-hmm.
They can give very, very good vision. Like surprisingly, patients say, wow, I never saw this clear before in my life.
Mm-hmm.
They can see like 2020
Yes, that's great for the patients.
in most cases, yeah. And actually, otherwise, also, there's so much advancement in technology that any prescription, patient with any prescription can have contact lenses.
Mm, oh, okay.
Sometimes patients come in, oh, my doctor said that I cannot wear the contacts because of my prescription. But they were such a small prescription, and they've been
Mm-hmm.
told that you cannot wear the contacts because of your prescription. So, patients with any kind of prescription can have the contacts.
All right.
I'm not exaggerating.
Mhm. That's great information because I don't think everyone really knows this. And
That's
to
right.
even like to wrap up the whole session, I would say like I was able to learn so much about vision, about eyes, about how to keep the computer close to you, how far the distance should be, and even about like orthocotology, the of improving your vision. I'm pretty sure not many people have heard about such treatments, and even to like fix your dry eyes. So I really want to thank you for introducing these new aspects to us and our viewers, that they're able to learn so much more about vision, about like things that we might as well take granted. We know we take vision granted. We just think of it a certain way, but we don't understand there's so many aspects to it, and there's various different solutions that can be implemented.
Mm. Yeah, thank you so much for hosting this session. Thank you so much for having us on your um, on your screen. And Dr. Chopra also. Thanks to Dr. Chopra, she does so much for, like I said earlier, so much for the.
Mhm.
She's also even arranging the vaccines for
Yes, yes.
the vaccines.
Um,
I heard
Right.
from
Mhm.
the and she's a tireless person. She does so many things, and if
Yes.
not, maybe we can share other like health. We give healthy living to our patients also. We give
Mhm.
those also and other information also. Why orthocardiology is important, orthocare is important, and why other treatments are important. And Dr. B specializes in visual hygiene, so vision therapy.
Mhm.
Because the kids who are not performing in schools, parents think that they don't want to work hard. Actually, that might not be the case, because they might have some issues with their vision. They cannot use their eyes properly. They can use their eyes for a long time.
Mhm.
Having 20/20 doesn't mean that they can use their eyes properly. And if somebody is not performing good in school, or even if somebody is performing normal in school, they still will get a lot of benefit from vision therapy, which Dr. B does. And some of the patients who are even older, they come in and they say they can see with like both eyes together, like depth perception. They see, wow, I never saw it in my both eyes together like this. So Dr. B specializes in that, and if somebody needs information on that area, we can give them that also. This is information about the visual hygiene and
Yes,
the.
we will definitely link all of these. We can link all these documents to the end of the video as well when you post it as a webinar for patients, and they can definitely get more information about it.
Yeah, sure.
I just want to say thank you so much for joining us on this session and taking your time out to educate everyone about eye vision, about visual hygiene, about the health and how to keep yourself and your eyes healthy.
Good. Thank you so
Thank
much.
you. All
Thank
right, have a great day. Bye
you
bye.
so much.